Dr. Nicole Rogers is here filling in for Dr. Patricia Ferris, and Dr. Rogers is here to tell us about a new treatment for hair loss. It's called platelet-rich plasma, or PRP. Good morning.
Good morning.
I know there are a lot of people like me who've never heard of this before. How long has this been around?
So this was something that was first described in 2006 by a Brazilian plastic surgeon. And it involves basically drawing up your own blood and then spinning it down and then extracting off the platelet-rich portion and injecting that back into the areas of hair loss.
And let's look at the video now, and you can describe what we're looking at here.
Sure. So this is my nurse, Michelle, and you can see she's drawing the patient's blood here, and we use a tiny, tiny needle in order to extract off the blood. And this process usually just takes about, 5 minutes or so in order to draw up that blood. And then this is my nurse, Nicole, and you can see she's actually putting that blood sample into a centrifuge where it gets spun at very high speeds in order to concentrate the platelets into 5 to 8 times their normal concentration.
And
so
the
this
platelets?
Yep, this yellowish substance here is the platelet-rich portion. And the reason platelets are important is they secrete growth factors like vascular endothelial growth factor, fibroblast growth factor. And then the idea is that they will help promote hair growth. And so you can see this is me injecting the PRP into areas of hair thinning.
How painful is this?
In this particular patient, we've actually performed a nerve block so that she really doesn't feel anything. And again, we use the tiniest needles that we can in order to keep our patients as comfortable as possible.
Let's talk about results. What are the results that you normally see?
Right. So if you look in the medical literature, you'll see about 40 to 55% of patients will see some regrowth. There's a lot of variation in the protocol, and some people will combine it with microneedling. Sometimes we also combine it with something called A-cell, which is a product that it acts as a fibrin matrix for the PRP. And so there's a lot of different protocols out there. It's something that I like to offer to my patients who've already tried other options. They've tried minoxidil, they've tried finasteride, they've tried spironolactone. Maybe they're not good candidates for the hair transplant surgery. So it's one more option that we can provide.
And how much does this cost?
So it varies. It's anywhere from $350 to $750 depending on how we do it and what protocol we use.
That's per session?
Yes.
And so, and again, how many sessions would you need to have in order to see results?
So I'm recommending anywhere from 3 sessions or more over about a 3 to 6 month period. Like any medical therapy, it takes about 6 months to see an improvement.
And what are the advantages of this kind of procedure for hair growth?
Well, the main advantage is it's safe. So it's completely autologous, meaning it's your own blood and your own tissues. There's no blood monitoring that's required. There are no drug interactions. And it's something that has no side effects.
And what are your patients telling you about this?
So far, they've liked it.
Well, and it sounds like it's a very interesting thing. And hair loss in women can be very painful.
Well, it can be very detrimental in terms of self-esteem and self-confidence. I like to think that we're able to help the majority of our patients with some treatment or another. It may not be the same treatment for everyone.